Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, March 25th, giving you the update from Albany Med. All right, Fred, we'll start with COVID. Yep. Here's the first graph. Capital Region, in-hospital beds, 107. We think about half of those are no longer infectious.
That's right.
But 107 is the number in that range for the last couple weeks.
Keep hovering there, plus or minus a little bit around that 100.
Here's the medical center, admissions and discharges. You can see about 1 to 2 per day. That continues to be the trend here as well. And then when you look at the morning census here at the medical center, this graph here, 28 in the hospital, Fred, 13 on the floor, 15 in the ICU.
Yeah, that's a little increase, Dennis.
Yes, and that is why I think our hospital census is going up, because once they get into the ICU, it takes a little bit longer for them to be discharged.
Their length of stay is pretty long sometimes.
6 on ventilators, and Fred, of those 28, 9 no longer infectious.
That's right. One good thing though, Dennis, no deaths recently.
That's right, fantastic. Let's talk about some vaccine numbers quickly. First of all, let's remind you, capitalregionvax.org. We encourage you to go out there. Website will show you not only the numbers that we share here, if you want to look them up by county. It will also show you where your eligibility criteria. It'll show you where you can get your vaccine. As of this morning, 348,000 have received at least the first dose. It's probably over 350,000 by now.
It's amazing, isn't it?
32% of the population in the capital region, 173,000 have completed the series, so that's about 16%. So we're making progress.
Definitely.
Fred, speaking about making progress and numbers, let's talk about length of stay. This is obviously a focus on this campus. Any progress?
So Dennis, pop up the slide for us. You can see that we continue to come down. The total length of stay is the top line, the dotted line, and the non-COVID length of stay is the solid line. So we are kind of closing the gap between the populations, but also coming down into more normative numbers. Length of stay is important, Dennis, because it creates capacity, and frankly, getting people home or onto their next site of care is important to them.
So I think we committed every Thursday we'll do an update on that.
We're going to show it every Thursday, keep the focus. And Dan Pause's got a group restarted, and they're focusing on the 100 things we have to do differently to drive that length of stay down.
There is 100 different things. One of the most important ones is the complex care group, which meets Tuesday, Wednesday, Thursday, and is a multidisciplinary group which focuses efforts on the more complex patients in our hospital.
Dennis, I think that was your idea, right?
Well, I took it from somebody else, but yes, it wasn't original.
Good ideas all are stolen.
Fred, if you drove up the Northway over the last couple months, you might have seen a large building being built at Exit 12, and it's completed now. The Center for Advanced Ambulatory Surgery, CAAS. What is that?
So Dennis, this is a joint venture, a 3-way joint venture. The Medical Center, Saratoga Hospital, and Capital Region Orthopedic Associates, our partners, our orthopedic partners. So the 3 of us have gotten together, developed, and now built this destination facility for ambulatory orthopedic procedures. So they're poised to open. I think they're going to start doing their first cases in the next month or so. It's going to be just a tremendous opportunity for patients closer to home to get the kind of care they need in orthopedic services.
So if people have not recently had to come in the hospital either for themselves or with a family member and had a joint procedure like a hip replacement, they may not realize that many of those patients can go home in the same day.
Same day.
Rather than staying in the hospital overnight.
That's right.
This building is fantastic, state-of-the-art, incredible surgeons, great partnership. And we look forward to it, and we congratulate everyone who made that happen.
It's just a wonderful project, and it expands that site. More services now in our Malta site. Again, a joint venture with Saratoga Hospital and the Capital Region Group. And
it's consistent with what the healthcare system has been trying to do, which is to bring services to the people in the locations where they need them.
That's right.
Which is wonderful. So Fred, speaking of orthopedics, we have a very special unit here in this hospital, one of many special units, B3, and they had a very important milestone recently.
That's right, Dennis. So patients on that unit, there are 30 of them at a time. It's a very busy unit. Have had surgery, sometimes might try to get up on their own, might be a little unstable, could fall. The nurses have to pay a lot of attention to prevent that from happening. They've had 100 days without a single fall.
That's incredible.
Going all the way back into November, not a single patient on that unit has fallen trying to get up to go to the bathroom or whatever. That just speaks to fantastic nursing care.
Winsley Gerald is the nurse manager there. She leads an incredible team. The patients there are often trauma patients, orthopedic patients. These are patients who are, by their nature, a little bit unsteady or unstable, and so that is really a lot of hands-on care.
Absolutely.
Congratulations to them.
Fantastic job to that unit.
A lot of segues today. So speaking of nursing, we have an important announcement to make. We've talked about this before, but we're excited because the day is coming. Today, Fred, you were there where you congratulated and thanked Dr. Louis Filhauer. He's our interim chief nursing officer because he's been serving in that role for the last 9 months.
That's right.
And the reason you did that is because coming Monday, we have our new chief nursing officer coming here.
That's right.
So Lisa Masarwe is going to be coming here, and we look forward to her coming here. She's got an incredible pedigree. Comes to us from the Kaiser system out in California, and we're really looking forward to that.
She's originally from Pennsylvania, so she's going to be used to the weather here, which is something to think about, I guess. She started her career in Erie, Pennsylvania, moved on to Ohio, where she was actually a professor of nursing at one of the Kent State campuses for nursing. Then went out to California, joined the Kaiser Group, spent a number of years there, going up through the ranks, and has a lot of good experience. I think she's going to do a really good job here, Dennis.
She is. We welcome her here on campus. We look forward to seeing her here, and I'm certain we'll probably bring her in, and let's get her on the video next week.
Actually, we're going to have her in the video. You're not going to be here.
That's right.
In early April, so she's going to be my partner.
Perfect. Fred, the Patient and Family Advisory Council is an incredible group. We've talked about that in the past. This is a group which is led in the Children's Hospital currently. Right. Dr. Barbara Ostroff and Mary Alice Cullen and Ann Martin. And these three individuals lead this group where they have parents of children who've been cared for frequently in the hospital to get their feedback, how to provide better care, quality care, safety care, patient experience. I had the privilege last night of listening in on one of their calls, and it was really one of the most remarkable meetings I've been in. It's exactly what we need to be doing to reach out to families to improve care here.
The voice of the client or the voice of the patient, it's really important.
Yeah. So I want to thank the three of those individuals for leading this effort. Vicki Master was also involved in the origin of this group, and hopefully more of that in the future.
Yes, absolutely.
And thank you to the families who participate. Your feedback is essential. Finally, Fred, Daisy Award. The Daisy Award, of course, given out once a month here. We talk about these each and every time. Alexa Robinson is the recipient, but Fred, you have an incredible story to tell.
Kind of a special story, and every Daisy Award, I think, is a special story and a special nurse, but this one is a little bit different. So she was actually nominated not by a patient she was giving care to, but by the roommate of a patient she was giving care to.
Incredible.
So this individual observed her very attentive care to a struggling patient that ultimately had to be moved to a higher level of care, and was just so impressed with how she handled things. In point of fact, it wasn't even her patient. She just noticed something was happening and dived right in. So just a tremendous effort on the part of Alexa. Thank you very much. She's only been here for about a year.
Oh, wow.
So I think she's got a really bright future, Dennis.
She does. I'm sure her family's very proud of her.
Absolutely.
So to restate, it was somebody in the room who saw the care and nominated, which means that really everybody is watching everything that's happening all the time.
Patients are watching us.
Yeah, as well they should be. So that's wonderful news. So congratulations to Alexa. There's a lot of things to run through, but a lot of important things happening. And it's a beautiful day here, and we certainly hope it'll be a beautiful weekend as well.
Yes.
That'll do it. For those of us who will be working here this weekend, we thank you very much, and we ask you to continue to take great care of our patients. Otherwise, we'll see you on Tuesday. Lisa, welcome on campus next week. We ask that you once again please take care of yourself, take care of each other, and we'll see you on Tuesday.